I'm Dr. James Lozada in Boston at the SOAP 2016 annual meeting. I'm Dr. James Lozada. I'd like to tell you about a project we've been working on for 2 years aimed at reducing the rate of blood transfusions for patients having total knee and total hip replacements. This is a virtual triage area right now. The worst patients taken immediately away and paramedics assessing others for their injury. Sam Hill had done something that a lot of kids commonly do here, slipping through this broken gate in a neighborhood onto a busy street where there's no crosswalk. This crash happened in the last 10 minutes, and as we look back here, you can see 3 vehicles that are very badly damaged. The initial reports from this scene are that possibly a drunk driver is at fault. Police tell us that they will be doing a blood test on that driver to see if in fact alcohol is involved.
Put your nickel in.
Retired draftsman Darlene Adair finally has time for her passions. 3 days a week, she's at the local senior center, teaching card games, cooking, and making friends. Joy fills her heart, but pain courses her joints, making days like this tough.
Walking is just painful. I'm afraid that I'm going to fall.
Doctors replaced Darlene's left knee in 2012, and she'll soon have her right knee replaced by the same surgeon. She hopes her recovery this time is smoother.
I was just weaker than a kitten.
Darlene! Her world started spinning while standing up for the first time after surgery. She couldn't move and was short of breath.
I was real scared. I thought I was ready to die.
Nurses quickly called a rapid response. Her hemoglobin had dropped 5 grams, and she needed a blood transfusion.
I was finally able to get up and walk a few steps with the walker.
Blood loss averages 2 liters during lower extremity total joint arthroplasty, according to many studies, and frequently requires blood transfusion. Our institution has historically followed this trend, so we partnered with orthopedic surgeon colleagues to launch a preoperative anemia pilot study.
What have we told you about iron?
It's 4 weeks before Darlene's scheduled knee replacement.
Great shape.
Her preoperative screening revealed iron deficiency anemia, so she's here for a 1-gram iron dextrate infusion to optimize her hemoglobin. Our analysis highlights the high price of perioperative anemia, more than $1,100 per patient in transfusion-related cost and an extra day in the hospital. Darlene looks forward to more strength, energy, and less pain.
Hopefully it'll help me exercise a little more so I won't sit on my butt and be so fat, you know.
We continue efforts to better coordinate patient care and treatment in the perisurgical home. I'm Dr. James Lozada at the University of Texas Medical Branch. Let's take a look at a few of the ways obstetric anesthesiologists are working to improve healthcare.
It's a city with an illustrious medical history. Boston offers the perfect backdrop for the annual meeting of the Society for Obstetric Anesthesia and Perinatology. The exchange of ideas adds to rich learning opportunities, like at the much-anticipated Gerard Ostheimer Lecture, What's New in OB Anesthesia, where Dr. Philip Hess urged action to address the rising U.S. maternal mortality rate, especially high amongst African-American women.
If we don't get this right, then nothing else really matters, does it?
Practice improvements have decreased rates of maternal hemorrhage, preeclampsia, and blood clots. But new killers have emerged.
Unfortunately, because of our changing demographics, the relative contribution of maternal comorbidities, cardiomyopathy, and cardiovascular disease have increased, so they are now the major killers of pregnant women.
These conditions and complications were the focus of active poster sessions, highlighting important case presentations and new research, much of it from fellows and residents, future leaders in the field.
I think this is the place to come to.
They are scattered everywhere.
Now you're going to go on the same ambulance as her, okay?
Patient after patient
You have neck pain?
on backboards, stretchers, some hobbled to safety while choking back tears.
Scary. People were laying everywhere. It was bad.
Police say the driver of this gravel truck plowed into a tour bus full of people.
Boom! From the back. I mean, loud.
Felt like a semi-truck hit you in the back end. I mean, no,
not a good experience.
Horrible for a pregnant woman in the last row of the bus, and this woman who paramedics helped. This is a virtual triage area right now. The worst patients taken immediately away and paramedics assessing others for their injuries. Rescuers treat 19 patients in all, taking 14 of them to the hospital.
This is actually a mini mass casualty, and what we did is have to disperse them between the area hospitals.
Police have ticketed the truck driver for looking away from the road, a quick glance that caused nearly 24 injuries. And that gravel truck is owned by Southern Nevada Paving. A spokesman this afternoon says safety is a priority for them, and they are investigating this crash. Live at Flamingo and Polaris, James Lozada, Channel 13 Action News.